reference-style drug profile for Pirbuterol. Pirbuterol, comprehensive drug information. 1. Generic name, drug class, brand name, drug forms. Generic name, Pirbuterol acetate, drug class, sympathomimetic bronchodilator, short-acting B2 adrenergic agonist, SABA. Brand name, Maxair Autohaler, withdrawn from the U.S. market in 2013, but may still exist elsewhere. Drug forms, metered dose inhaler, MDI, breath-actuated device. Each actuation delivers 200 milligrams per buterol base. 2. Definition. Pirbuterol is a short-acting B2 receptor agonist used for the quick relief of bronchospasm in asthma. It works within minutes and lasts 4 to 6 hours, making it suitable for rescue therapy, not long-term control. 3. Mechanism of action. Selectively binds to BD2 adrenergic receptors in bronchial smooth muscle. Activation of adenylate cyclase increases intracellular cyclic AMP, CAMP. CAMP activates protein kinase A, which decreases intracellular calcium, inhibits myosin light chain kinase, relaxes airway smooth muscle. Result bronchodilation, improved airflow, reduced wheezing, and relief from shortness of breath. At higher doses, BEAT1 receptor stimulation may occur, tachycardia, arrhythmias. 4. Uses. Relief of acute asthma symptoms, rescue therapy. Prevention of exercise-induced bronchospasm, taken before exertion. Off-label, COPD-related bronchospasm, rarely used now, newer drugs preferred. 5. Indications. Asthma, reversible obstructive airway disease, relief of acute attacks, or prevention before exposure to triggers, exercise, allergens, cold air. Not indicated for chronic, daily maintenance, or nocturnal asthma prevention. 6. Contraindications. Hypersensitivity to Pirbuterol or formulation ingredients. Allergy to sympathomimetic amines, rare but possible. Acute cardiovascular events. Relative contraindication due to risk of worsening. 7. Precautions. Before taking this medicine, tell your doctor if you have cardiovascular disease, ischemic heart disease, hypertension, arrhythmias, risk of worsening angina, arrhythmia. Seizure disorders. B agonists can lower seizure threshold. Hyperthyroidism may worsen symptoms, palpitations, tremor. Diabetes mellitus. B agonists may increase blood glucose. Hypokalemia risk. Pirbuterol can cause potassium shifts, risk of arrhythmias, especially if also on diuretics or corticosteroids. Pregnancy and lactation, Category C, use only if benefits outweigh risks. Measure 8, how to use administration instructions. Inhaled orally via breath-actuated inhaler. Steps. 1. Hold inhaler upright and shake well. 2. Exhale completely. 3. Place mouthpiece between lips and close lips around it. 4. Inhale deeply through the mouth, drug automatically released. 5. Hold breath for 10 seconds, then exhale slowly. 6. If a second inhalation is needed, wait at least 1 minute. Clean inhaler regularly to avoid blockage. Do not exceed recommended dose. Measure 9. Dosing information. Adults and children under 12 years, 2 inhalations every 4 to 6 hours as needed. Maximum, 12 inhalations in 24 hours. Children 12 years, safety not established. Elderly patients, use with caution due to higher sensitivity to cardiovascular effects. Number 10. Misdose, overdose. Misdose. Since Pirbuterol is a rescue inhaler, use only when needed. If you forgot and symptoms occur, use as soon as possible. Do not double up. Overdose symptoms, severe tremor, nervousness, chest pain, fast or irregular heartbeat, severe headache, seizures, muscle cramps, hypokalemia, severe hypertension or hypotension, requires emergency medical attention. Number 11. Stop or avoid taking. If you develop paradoxical bronchospasm, worsening wheeze, shortness of breath after inhalation, severe allergic reaction, rash, swelling of face, tongue, difficulty breathing, persistent chest pain, or irregular heartbeat. Number 12. Side effects common. Tremor, nervousness, restlessness, dizziness, headache, nausea, dry mouth, cough, palpitations, mild tachycardia. Serious, seek medical help. Chest pain, angina, arrhythmia, severe hypertension, hypotension, seizures, paradoxical bronchospasm, hypokalemia, muscle weakness, irregular heartbeat. Now 13. Vital information. Key safety notes. Pirbuterol is a rescue inhaler only, not for daily control. Overuse may mean poor asthma control. Long-term controller medication may be required, e.g. inhaled corticosteroids. Always carry the inhaler if prone to asthma attacks. Prime inhaler before first use or if not used for several days. Patients should be trained on correct inhaler technique. 14. Drug interactions, beta blockers, especially non-selective like propranolol, antagonize Pirbuterol, may cause severe bronchospasm. Other sympathomimetics, albuterol, epinephrine, decongestants. Additive side effects, tachycardia, tremor. MAO inhibitors or tricyclic antidepressants within 2 weeks potentiate cardiovascular effects, hypertensive crisis, arrhythmias. Diuretics, loop thiazide, increased risk of hypokalemia. Corticosteroids and theophylline, additive risk of hypokalemia and arrhythmias. Digoxin, BD2 agonists may lower digoxin levels, monitor closely. Thank you. Have a nice day.